Hey there, Dr. Andrew Gorecki here again. For those who don't know me, I'm the owner of Superior Physical Therapy, and my job, my mission in life is to help as many people that have back pain or sciatica find a natural solution so they can avoid medications, they can avoid surgeries, they can avoid injections, they can find a natural way to heal. That's what we're going to be talking about today. But before I get started, if you like what I'm talking about and you're serious about finding a natural solution, I'd encourage you to visit back-class.com where you can learn even more useful information. Okay, now who I want to talk with today is the person who's had back pain for a little bit of time, and you've gone to the doctor, you've gotten your pain medication, your anti-inflammatories. Now you've gone back to the doctor and they've ordered an image, right? So they've ordered an MRI or an X-ray. Typically the X-ray's first, MRI second, and you've gotten the results back. And the results are showing that you have something that's changing in your spine. Most commonly, we're going to see disc bulges, disc herniations, or degenerative disc disease, or stenosis, or what's also known as arthritis in the spine. And you're kind of freaking out because you're like, oh my gosh, what are we going to do now? I've got these changes. My spine must be damaged. I want you to pump the brakes for a second, and I'm going to try to help calm you down and hopefully give you some hope. We have a study, really big, systematic review that looked at like over 10,000 patients, and these patients were all with no pain, so they were asymptomatic, and they did an image of their spine and specifically the low back, and what they found was pretty fascinating. They found that basically after the age of 20 that statistically it's very, very high percentage of the time people have changes in their spine that include disc bulges, stenosis, degenerative disc disease without any pain. So you get this information and you're thinking, all right, what do I do now? Well, don't immediately believe that that structural change you see on the image is the cause of your pain, because most of the time it's not. And we have to be careful because that becomes a pathway that we want to be careful where we go next. Very commonly when we find these damaged structures in the spine, which we know are common and normal and natural, and they are not necessarily the cause of your pain, it leads us down a path to talk to the neurosurgeon, which increases our likelihood of having surgery, which we'll talk about some other day. But we don't want that, right? You don't want to have to do that. And so what should you do? Well, first of all, you shouldn't be completely sold on the idea that that's why you're having pain, because we have studies in science to prove that that's not the case the majority of the time. We should pump the brakes for a second and realize that most back pain is a movement disorder, meaning the reason that we're getting pain, and it really comes down to how the back is designed. So we know that if you're having back pain or sciatica, the nerve is being compressed. And we know that if you look at the anatomy of the spine, the nerve is coming out of a hole on each side, and it comes out of the hole from the spinal cord. And that hole is actually a bony hole. And it's two half circles of bone that are stacked on top of each other with a disc in the middle. And the cool part about that is that the nerve hates it when that hole gets small, and it loves it when the hole opens up. But when you're moving throughout the day, certain movements cause the hole to close down because the hole is dynamic. It's moving all the time. It's two half circles that make up this hole. So you're going to get some movement that's going to close the hole down and some that opens it up. The reason that some people have pain and some don't with structural changes in their spine is because the people that don't have pain are the ones that have good motion in the rest of the body, and that hole's not being forced to close down. So the next step really should be finding a physical therapist, someone like me who specializes in back pain, and getting them to assess your body and how the whole body moves, and trying to figure out what are the movements that make that hole close down more than it wants to. Regardless of what your diagnosis is, you could have a disc bulge or a herniation or a stenotic hole or arthritis, degenerative disc. It doesn't matter, the hole still is opening and closing. We got to figure out what's making that hole close down too soon. So if you're out there and you just got that image and you're freaking out, don't freak out. Pump the brakes on seeing the neurosurgeon. Go visit a physical therapist. They're the ones that are the most trained and can help you understand whether or not movement in other parts of your body is going to help you feel better. And I hope this helps somebody. This is my specialty, so I've seen it many times, And that image can be devastating, and it can make you really nervous and scared. But don't be nervous and scared. It's really common. It's actually uncommon for people to find nothing on an image. So hopefully that helps. If you're serious about finding a natural solution and you like what I'm talking about today, simply call Superior Physical Therapy and we'll set you up with a movement assessment to see if we can help. And hopefully someone out there is listening to this. You're enjoying it as much as I am enjoying making it. Have a good day.